you know, I'm very concerned about this health care proposal. We need to have more affordable and accessible health care in this country, but we should not do it on the backs of seniors. This current proposal takes $500 billion out of Medicare, health care for seniors, and I can't stand for that. The Medicare program already in the future is going to have trouble meeting its obligations. We can't take money from Peter and give it to Paul in order to afford this new health care plan. Well, I think we have to make sure that the system is transparent as to what our actual costs are. None of us know what these health care costs are and what they really are. They get gamed by the hospitals and the insurance companies, and we as consumers are not involved in the process. So the first thing is transparency. What do things cost? Get the consumer involved. Let us make decisions based upon what's the best decision for our families. The second thing is we have to get rid of waste, fraud, and abuse. There's an estimate that almost $60 billion of Medicare money is in fraud. That money could be used to help seniors get health care. So before we tackle new health care initiatives, we should try to fix the ones we have and make sure that we go after waste, fraud, and abuse. Well, the real concern here is that the federal government's not going to pay for it. What they want to do is put more people on Medicaid. Right now, it's at the poverty level, and they want to increase it to 133% of the poverty level. So more people would be able to get free health care because they're struggling and they're poor. Well, that's laudable, but the problem is who's going to pay for it? And the federal government in the Baucus proposal isn't going to pay for it. The people who are going to pay for it are the states, and they're going to send this bill, if you will, to the state governments, to governors and state legislatures, and say, you've got to pay for this health care. And we estimate in Florida that would be another $4 billion that the state of Florida would have to pay for health care, which it can't afford. Right now, Florida's in its own tough times. At least it has to balance a budget in Florida, and they're doing a great job down there under Governor Christ, but we can't send another bill to Florida or any of the states in this country and say, you've got to pay billions of dollars more for these folks.